Hey everybody, just wanted to say hello. We are so privileged today to have an infectious disease doctor with us to answer questions about COVID-19. If you have any questions, put them in the comments below. We'll try to get to as many as we can. I know I have a lot of questions, and the biggest thing I want to let folks know is we're not trying to be political. We're not trying to talk about a lot of the politics behind this. We're trying to just talk about how regular Iowans or wherever you live can deal with this. And this is something we've never seen in probably any of our lifetime. And so with that, I want to introduce Dr. Rosa. Thank you so much for joining us.
Hi, thank you very much for having me.
So before we open it up for questions, I have a couple things. We got 66 new confirmed cases in this. Well, actually, before I go there, let's talk a little bit about how we got connected. Last week we had Dr. Parent sorry, had a brain freeze there, from Iowa City. I think he retweeted something of yours, and so we saw each other through Twitter. And so you were mentioning a little bit about how you use Twitter. Do you want to talk a little bit about that?
Yeah, I think I joined Twitter, I don't know, maybe 7 years ago. I don't know, a while ago. Yeah. I've primarily used Twitter to connect with other infectious diseases physicians. It's actually a really good space where people share new papers. They share their comments on papers, on science, on the struggles that us infectious diseases physicians have been having for a while. So that's, so I've been primarily a lurker. So really just reading other people's tweets and following, papers and stuff like that. And as the cases have been, growing and growing, and as we've seen the impact of COVID-19 on our communities, not only from a health perspective, a public health perspective, but also an economic perspective, I just felt like I had to say something. And I like to keep track of numbers. Yeah. Part of what I do. And so that's why I started my Excel spreadsheet. Again, it's not fancy, it's not high tech. You don't even need Excel, right? If you want to use Google Sheets, you can create one of these ones. It's publicly available data. And so I started tracking these cases essentially just for myself. And then as I saw the curve just, picking up, I felt like I just needed to say something, about it. And that's why I started tweeting specifically about the cases of COVID-19.
And so every night you've been posting it, and we try to retweet it as once I see it, just to give information out there so folks know what's kind of going on. Today it was confirmed 66 new cases. That brings our total up to 614. I know here in Western Iowa we have a couple new counties that are seeing it's starting to spread more and more, obviously everywhere, but here in Western Iowa, we were a little slow to get it. We are a very rural part of Iowa as well. But then we also found out 11 people have died at this point. We had 2 more that died. And so I guess from your perspective, one of the things in your tweets, you talk often about the stay at home, wanting people to stay at home. Can you talk a little bit about that and why that is important?
So essentially what we know about this virus is that the way it spreads, usually something that we call the basic reproductive numbers. So each patient that is infected, it's estimated to go on to infect between 2 and 3 other people. That basic reproduction number depends on certain other variables, such as how long a person stays infectious, how long or how many opportunities actually the virus has to come in contact with other people, essentially through contacts that people have, and how many are susceptible. So, even though those are different variables, what you can see is that the common thread through it is that in order for the virus to continue spreading through our communities, it essentially depends on human contact. And so, we are social creatures. We want, we want to talk to others. We want to be close to others, with our loved ones. We want to, hug them and hang with them. And so, because the virus spreads through person to person contact, and contact that has to occur in like relative proximity, the best and perhaps the only way to actually cut those chains of transmission and decrease the amount of new infections is for everyone to really isolate. We do not have a vaccine. That would be the other way in which one can prevent. You don't hear us infectious diseases doctors, at the beginning of the influenza season say, everyone go home, right? We don't, because we have a vaccine. We encourage people is to get a vaccine, but we don't have a vaccine for COVID-19, for the SARS coronavirus that causes this. And so all we are left with is to actually distance each other. And, when you're talking about an entity, like this virus hadn't even entered, our collective consciousness here in the United States in probably February. People were not even paying attention, right? The first case occurred in January, but people were not really paying attention back then. Didn't even enter the world's consciousness, humankind, until December. So we're all susceptible. We're all susceptible to it, and some of us may get sick and get over it, but it is possible that we get sick and then give it to someone who might die from it. That is the reality of it, that people will die. And if people don't stay, if people don't stay home, if people don't cut those chains of transmission, people will die.
Yeah. And have you dabbled with the modeling that has come out in the last couple of days? I think last night on Twitter, that started to be more present, I feel. Can you talk a little bit about that?
Yeah, so I'm not an infectious diseases modeler. I will start by saying that.
Yeah.
When the problem right now with, let's talk about what a model is, right?
Okay.
So a model is essentially, a tool that allows you to incorporate different variables about something, in this case, a virus, and then based on those variables, try to predict an outcome. Different types of outcomes have been predicted. Number of beds that we're going to need. So, number of people that will be hospitalized, number of people that will be critically ill, and number of deaths. So essentially, you take information, you process that information, and you make a prediction.
Okay.
The problem with the variables that go into your model is that they usually depend on assumptions and on information. And in this case, we just don't really have a good way to determine what that information actually is, because we still know relatively little about the virus. Furthermore, some of the things that you have to take into account when you build these models, such as the prevalence at your community level, the number of new cases that you are seeing, the true fatality rate, so how many people are actually dying from this. Those are variables that are really difficult to fully determine if you can test accurately. Okay. And we can't. So testing has been the biggest failure that as a country we have encountered in trying to control COVID. Why? Because if you test, you are able to identify, isolate, and treat, and give specific recommendations. But because from the get-go, we actually didn't have a good testing capability, that has left us trying to test only those ones who we are actually super sure that have the disease, mostly because they're already in the hospital.
Yeah.
But we haven't had the true capability to test even those ones who are mildly symptomatic, so we can firmly tell them you need to isolate yourself.
How sure are we that the test, when we test it's coming out accurate? I thought I saw a
Yeah.
Wall Street
So
Journal article today about that.
yeah. So the thing is that whenever a new test comes to the market, right, or is made available for people to use it, usually the accuracy of that test in general is compared to something that we call the gold standard. So the gold standard would be the test that we know for certain actually tells you that somebody has the virus.
Okay.
And the truth is that there's actually no real gold standard. What we can talk about is the individual performance of the tests that have been made available either through individual commercial vendors or the state. And so furthermore, the whether you're able to pick up the virus in someone's sample may depend on the quality of the sample and even on how many days have passed since the symptoms started for that specific person. So there's different variables that go into it. In general, we do know that the best tests, well, let me rephrase, not the best, but perhaps the tests that tend to always come back positive are the ones that are from deep what we call deep respiratory samples. But those are tests that we tend to actually take when someone is already really sick and in the hospital.
Okay.
So as we do more testing and as we, more samples get collected, usually from up your nose, we've all seen those images of how those tests get collected, we will know more about how reliable those tests are, not only in terms of the performance of the test in the lab, but also in relation to when they were collected, in relation to a patient's onset of symptoms.
Okay. And then there's a lot of talk about 25%. I've heard the number thrown out there quite a bit on people who are asymptomatic but have it.
Yeah.
Is that what you're hearing too, or?
Yeah, so I don't think a number has been firmly established as to what is the true percentage of asymptomatic infections. I certainly heard the comment made by the director of the CDC, which
Yeah,
threw
that's where I
out
got that. Yeah.
25%. Other studies, some of those studies being in preprint, meaning that they haven't been formally peer reviewed and published in scientific journals.
Yeah.
Some of those studies are putting that number between 5 and 15%. So I go back to say, we don't know.
We don't
And
know.
because we don't know what is the true percentage of asymptomatic patients, it's why it's even more important that people stay home.
Yeah.
Once there's community spread, it's not about like, oh, have you been in New York? Have you been in California? Did you go on a cruise? Perhaps those were relevant questions 3 or 4 weeks ago. They're not even relevant anymore. Right now, we have community spread. And when we have community spread, that means that you can pick it up anywhere in your community. The only way you're not going to pick it up anywhere in your community is if you stay home.
Yeah. Yeah, that's a good point. So can you talk a little bit about the symptoms and then what people should do if they end up getting symptoms?
Yeah. So the symptoms that we've seen more frequently being reported include fever, cough, shortness of breath, or feeling like you can't catch your breath. Recently, reports have come up that very early in the course of the infection, you might also lose your sense of taste and smell, and you might also feel like a little bit weak and have some body aches and things like that. It is primarily a respiratory illness, so be on the lookout for things like fever, cough, and feeling like you can't catch your breath. if you are having symptoms, it is very important that you call your primary care office. If you don't have a primary care provider, then you can call, well, at least here in Polk County, where I live, we do have the 211 line. Yeah, I'm sorry if I don't know if similar resources are available throughout the state.
I think 211's for the entire state.
Oh,
I could be
okay.
wrong on that, but
I think
yeah, I don't want to give wrong information out, but I think it is for the entire state.
yeah, so to contact and to talk with someone through and go through those symptoms.
Okay.
Again, for 80% of the people that go on to develop this infection, that infection will be mild. It's still very important though that you keep track essentially of how you're feeling, talk to someone so they can give you, guidance, or point you to how to access care in case you actually need to do it. In general though, the advice, again, if we could test everyone, we would.
That's the big thing, is if we could test everything.
And so it is sad. It is really disheartening that we essentially have to tell people, if you're feeling really bad, that's actually when you might need to go to the ER. Don't just show up in the ER though. It is better, if you either go through your primary care doctor or through one of the emergency services that have been set up, so they can at least try to coordinate your arrival into higher level of care.
For everyone who is watching, my wonderful comms director, Lauren, did text me. 211 is available for the whole state. It's free and it's 24/7. So
okay, great. Sorry, I didn't know that.
No, it's good. We're all learning here, and we're all adjusting, and so it's been very unusual times. What are some of the things? Okay, so staying at home. What are some of the next steps for us? And I see some of the modeling. Again, you're not the model person, but at the end of the month and May 1st, those are kind of the dates that it looks like it will peak here in Iowa. Can you talk a little bit about what you know about that?
Yeah, so again, the problem even with those predictions is that and don't get me wrong, I'm not saying that they are problematic or that they are bad science. Right. They are not. I know that the people working on building those models, are really doing their best.
Yeah.
The issue is that those predictions actually need to be constantly adjusted, and they are. The scientists behind this are constantly adjusting it, because they adjust them based on what they see on the ground. Yeah. And so they put together, the numbers of new cases. And essentially, if we are seeing evidence of the mitigation strategies actually working, and so if the scientists see that the mitigation strategies are not being followed, that if there is a recommendation for people to stay at home but people are not staying home, then that even that prediction will change, and it may change not only as to when is expected to peak, but also the intensity at which it will peak.
Right.
Unfortunately, again, we are dealing with so many uncertainties.
This is so new, and I think people, we're in such a world now where we want fast answers. And there's just answers. These are the best ones to do. So
you're so right about that. People want answers now. People want and I understand, right? We want to know what to do, and we want those answers to essentially be written in stone. Like you said, I needed to do this or that 1 month ago, and I'm like, 1 month ago was 10 years ago. So be prepared for uncertainty, and stay tuned to good sources of information, because the information will change.
Yep, and that's why we had, like we said, we had Dr. Parents Savage last week. We have you today, and we're going to have people next week as well. We're just we want to make sure that as we go forward, we continue to just get people the information they need to know about this. And so we have our first question from Twitter. I've read, and this is what they said. They said, I read some confusing info. Droplets stay in the air for minutes and then fall to the ground. I also heard droplets can live in the air for 3 hours. Is there any info on that?
What we know about this, what we know about viruses, or viruses like this one in general, is that they are transmitted through droplets, and droplets are relatively large particles, so that they do not, hang around in the air for too long. They drop to the floor. Importantly, they drop into surfaces. That's why we tell people to wash their hands and clean their. Now, when you perform certain types of medical procedures, those droplets you generate a different type of particle called aerosols. So aerosols are even smaller particles that can actually, really can just hang around in the air and float for a little bit longer. The studies that have suggested that COVID-19 can be transmitted through aerosols, essentially what they've done is perform that type of procedure, what we call aerosol generating procedure, and see if they can then go on and find the virus in the environment. So in the regular human everyday interactions that we have, talking, or if you're close to someone and they're coughing, that's essentially how the virus, that's the main form through which the virus will transmit. The other thing is that the studies that have been done that say, hey, maybe this thing is also airborne, have recovered the virus, but that doesn't mean that the virus remained viable after many hours, because we do know that the virus can degrade relatively fast. And so you may be able to recover, but what does that even mean? Can it truly be transmitted?
Yeah.
I will go on to say, though, that we all in the scientific community have to be humble and realize that we are still learning a lot about this virus.
Yeah. We have another question here. What is the main thing we can do to mitigate COVID-19?
Stay home. I wish I could tell you, it's about, taking a pill or something like that. Right now, the only tool that we have to mitigate the virus is to distance each other from other humans. That when we go out to do essential trips, to the grocery store, or, to get food, to get medication, that we minimize our interactions with other people, that we stay at least 6 feet apart from others, and that we practice good, a lot of hand washing and keeping our surfaces clean as well. I really wish it was something different. Yeah. And it sounds simple, but I also understand that it's really not. But that's the only thing that we have right now.
And we have another question here from Evelyn, who asks, how will we know when it's safe when there's hardly any testing?
Yeah, so I can't really answer that question right now. We will, I know that there are some companies and some universities, some research centers that are working on producing something called serology studies. Serology studies are types of studies where we get blood from people, and then we are able to check if they have developed antibodies. So when people say, have I developed immunity? Am I protected? What we are measuring is whether you have developed antibodies. How long will those antibodies last? We don't know. But you can use that information essentially to try to determine how many people in a community have already had the virus and could potentially be safe. But in reality, we don't know. The curve does not look flat. And until we are past that hump and the curve looks flat, it's not safe to return to our normal life.
And we got another good question here from Aaron. Mosquitoes are starting to show up as we get into summer. What are the chances COVID-19 will be transmitted via mosquitoes?
Yeah, so this virus in general, we know it's a respiratory virus. So that means that the type of cell where it primarily reproduces, it's in your lungs. It has been recovered from other substances. So for example, poop, it's been recovered from, from that too. And in very few cases, it's been reported to, like, researchers have actually been able to sequence it out of blood. But it is not thought to be a primarily blood-borne pathogen, which is where it would have to live for a really sustained and prolonged period of time in order for a mosquito to come bite an infected person, get blood and virus out of, them, and then go on and give it to someone else. I don't think that has been formally studied, right? But we don't think that this is how we don't really think that this is how it transmits, because it's a respiratory pathogen.
And if somebody recovers from it, can they get it again?
Yeah, so that's a big question that, again, we don't fully know. We do know from studies that have come out of China that people develop antibodies, again, what would people call immunity. But we don't know many things about that. For example, we don't know if those antibodies provide full protection or only partial protection. And we don't know if they last a few months or if they go on for your lifetime. So these are things that we are still trying to figure out.
Right, okay. And Lynn asks, and Lynn's a family friend, so hi Lynn, hope you're doing well. Do you agree that we should have a statewide shelter in place?
That's a really loaded question. And I really trust that our authorities are, really taking into science and making the decisions with, Iowans' best interests at heart.
Yeah.
What I know is that so far, already everyone has been told to stay at home. So it is our duty to be, responsible, citizens and residents of Iowa. And if we've been told to stay home, then we have to stay home. And, if we enforce, in a way, peer pressure, if you see other people out, be frank with them and say, hey, we're all in this together and we all have to make sacrifices.
Mm-hmm. That's exactly right. Michael asks, are the rural areas ready to deal with this?
That's also a really difficult question. We know that our rural hospitals have been struggling for a really long time. And we have to, they may face shortages in terms of the number of beds. But one thing that also worries me is that we do know that some people will get critically ill, and some smaller hospitals may not have the infrastructure to actually deal with those cases, and may have to, with people that are more critically ill, and may need to transfer to higher centers. We've been preparing for a really long time at my hospital, and and it's our infectious diseases preparedness doesn't go back only to the 2 months that we've been dealing with COVID, but through other crises like H1N1, Ebola, things like that. And no amount of preparation can be enough for the deluge of cases that are being predicted. So as much as we want to say your hospital will be prepared, we cannot say that. It really depends on each one of us on doing our best to physically distance. We can only rely on ourselves to actually do that and flatten the curve.
Yeah. Dr. Rosa, thank you so much. I don't want to take too much more of your time. We're starting a new thing called Thankful Thursday. So my first Thankful Thursday are for people like you and all the frontline workers. Thank you for what you're doing and helping keep Iowa safe. And I'll continue to retweet when you post your
Thank
things.
you.
So,
Thank you very much, and thank you. Thank you for shining a light on this and on really trying to on asking tough questions, but really good questions. And I hope that if you invite me back again, I will have more answers rather than we don't know. Okay.
well, and this is what we talk about. We're all in this together. There's so much stress on you guys to have answers when everyone's still learning about this. And so I'm appreciative, and I know so many people and all the folks you don't get to see them because this is virtual, but I'm sure they're giving you a round of applause for having here. So thank you very much for your time.
Thank you very much. Have a good night.
Thank you. You too.